right, close, far. Okay, good. H, P, F, purple, 2, gold, 4, sharp, dull. Hi Sydney, welcome in today. How are you feeling? Okay. Yeah. I did get your message about a little bit of pain and discomfort as to what brought you in today. Do you want to go ahead and tell me a little bit about what's been bothering you? Yeah, I was just at the gym the other day, and when I was lifting weights, I just got really dizzy and disoriented. Okay. I went home, tried drinking some water, but then that's when I noticed my back was really hurting. I've just been kind of disoriented since then. Okay, I'm gonna just grab my notebook here and take down some notes. And when was this experience at the gym? So I was deadlifting. So right when I had pulled up the bar, I just got a little dizzy. I thought maybe I hadn't eaten enough. Gotcha. I'm just jotting down here that it was during a deadlift. And how many days ago was this? It was 2 days ago. Okay. The pain in your back, is it more upper back, mid back, low back? It's like my low and mid back. Okay. Okay, and then just some basic questions to go over here. Have you had any recent medication changes? No. Okay. And have you been out of the country in the last 6 months? No. And do you normally have a gym routine? Is a deadlift something that is a normal part of your schedule? Mm-hmm. I'll deadlift once a week. Gotcha. Was the weight amount a new amount that you hadn't tried before, or is this something that you've been able to execute in the past? I've been able to execute it in the past. It is a heavier weight for me, but I haven't had any issue with it before. Okay. I was trying a new grip though. Okay. Have you tried any over-the-counter medications to relieve your pain here? I was trying just some Tylenol. Okay. Has it been very helpful or not really? I mean, a little bit, but the relief only lasts for a little while. Okay. Let's see here. Let me just briefly thumb through this really quick. Just checking on some notes from your chart here. I have that your last physical was around a year ago. Does that seem accurate? Okay. And I have that you're not taking any current medications. Is that still accurate? That's correct. Okay. All right, Sydney. I'm glad that you've come in and brought this up. It's definitely best to look at these type of injuries closer to when they occur. So thank you for coming in. I was able to jot all this down and I will add it to your chart. For today, we're going to perform a head-to-toe exam, also serving as more of a physical up-to-date since you're due for one anyways. We're going to start up by the head and face, check the ears, nose, mouth, do a bit of sensory testing as well. Then we'll move down, take a look at the stomach. you'll flip over. I will take a look at your back, really assess the vertebrae there, and then we'll finish checking out the ankles and feet.
Great.
Does that sound like a good plan for today?
That sounds great, thank you.
Okay, of course. And put on some gloves. Continue to just relax. I'm just going to position myself here where I'm going to gently begin to feel the face with gentle palpations. Feeling the lymph nodes. Nothing seems excessively swollen, which is a good sign. I'm going to take your temperature. I'm just going to turn on our temperature gun. Okay, showing 98.5, which is a good temperature. I'm going to use my stethoscope to check for the heart and the lungs. Go ahead and breathe normally. Move this down a tiny bit. Go ahead and take a deep breath in for me. And exhale. One more deep breath in. And exhale. Great, you can relax. I'm going to just listen with the bell side. Just turning it over once more. Okay. Everything is sounding healthy. I'm going to grab this to test for blood pressure. Perfect. This shirt isn't too thick, so we can just go right over the top here. Great, and you can relax. I'm going to slide this into place. Set this up to monitor. Alright, the blood pressure levels were nice and healthy, which is good. I'm going to gently remove this. Okay. I'm going to check your oxygenation levels at room air. Go ahead and lift your finger. I'm going to just put it inside of this machine for just a second. I also am going to take your temperature one more time with this thermometer here. I'm putting it inside of this container here. just going to press this. You can just press this gently under the tongue. Just going to hold this here for a second. Go ahead and close your eyes. Remove this. Perfect. Nice healthy temperature. I'm going to set this aside now. And just one more time, doing the palpations that I had been doing earlier. Just really assessing the neck. I'm gonna take a look at your scalp as well and ask you to turn your head all the way to the left for me here. Perfect. So I have a little bit better access to the scalp. Just gently comb some of your hair out of the way. A light here and a tool to take a closer look at the scalp. Gently parting the hair. Trying to remove this. No signs of any redness or itchiness along the scalp. Just gently dividing the hair. Using a lice comb. Making sure there's no signs of any discharge, any lumps, bumps, bruises, anything that might raise some levels of concern. You had mentioned some dizziness, so just want to make sure that it's nothing externally reflected in the condition of the scalp. I'm going to use the steel ice comb as well, just to slowly sift through the hair, making sure that there's no signs of any lice, ticks, mites, or any unwanted creatures. Scalp seems nice and hydrated, which is always a good sign. No flaking or redness. I'm just going to check the crown of the head as well, right along the parting line of the hair. Gently brushing out the work that I did there. Okay. I'm going to go ahead and take a look in your ear now using my otoscope. Continue to relax. And take a look here. The ear is looking nice and healthy. No signs of drainage or dripping. No excessive wax. Nothing that is requiring any drainage. Everything looks healthy. Okay, I'm going to have you turn your head all the way towards me so I can take a look at your other ear. You can just continue to relax. Okay, same as the other side. No signs of any drippage or draining. Nothing red or inflamed. Everything is looking perfectly healthy. And go ahead and return your head so that your chin is pointing down and your eyes are looking straight up. I am going to go ahead and perform a hearing test so you can keep your eyes closed. I do have 2 water globes here. I'm going to gently rest them on either side of your head. I want you to let me know whether you hear the sound on the left, right, or both.
Right.
Good.
Left. Both. Left, right, both, left, right, both, right, left, both, right, both, left, right, left, right, both, left, right, both.
I'm going to try a slightly different hearing test. You're going to say if the sound that you hear is close or far. I'm just going to be snapping my fingers either a far distance or a closer distance. And just let me know if that sound is close or far.
Close, far, close, far, 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 close, close, far, close, 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 far, 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 close, close, far, close, far, close, close, far.
Okay, good. I'm going to move on. We are going to take a look at your sense of smell. Okay, I'm just going to go ahead and take the otoscope and insert it by the nostrils. Just go ahead and relax, nothing too intrusive. Okay, good. Both nostrils are looking nice and healthy. No signs of any discharge, draining, no swelling, no signs of any redness. I'm going to conduct some smell tests here. Go ahead and keep your eyes closed. I do have a vial here. I'm just going to gently put it onto this cotton pad. It does have a strong scent. Set this aside. I'm going to let you inhale on the count of 3. Just take a deep breath. 1, 2, 3. And what is the flavor or scent that you're picking up?
Like alcohol.
Good. And once more, I have a cotton swab. I'm going to go ahead and spray it. Setting this aside. Go ahead and inhale on the count of 3. 1, 2, 3. And what is it that you smell?
Fruity, like oranges.
Good, good. All right. We're going to move on to taking a look at the mouth. I do have this wooden tongue depressor. Okay. Go ahead and stick out your tongue and say ah. Ah. Okay, good. Everything is looking nice and healthy. No signs of any swelling. Tonsils are a good size. The tongue is a nice healthy pink. Okay. I do have a vial here with a food-safe paste. We're going to gently drop a bit onto your tongue, and you can tell me what flavor it is that you taste. Go ahead and stick out your tongue, and I'm dropping right now.
Mint.
Good. Setting this aside. And moving on to another vial. Okay, this one's going to be a different flavor. Go ahead and stick out your tongue. I'm going to drop this on right now.
Sour.
Good. Okay. Moving on, I'm going to take a look at your eyes. Go ahead and open your eyes. Go ahead and look into my eyes. Okay, good. Good. Pupils are round and reactive to light. Okay. You can go ahead and just relax your face. I'm just going to have your eyes follow the movement of my fingertips here, so just gently rest your eyes onto my fingertips. I'm just going to gently move them around your field of vision. Okay. Good, and you can relax. I'm going to have you reach up and use your right hand to cover your right eye. And I'm going to have you hold this in your left hand. Go ahead and extend it all the way out. Great. And I'm just going to be pointing with a little pointer here and having you read the rows to me. Okay, go ahead and start and read this row starting on the left and moving to the right.
E, P, T, Z, O.
Good. Go ahead and read this row starting at the right and moving to the left.
H, P, F.
Good. Go ahead and read this row starting at the right and moving to the left.
H, P, F, T, L.
Good. What letter is this?
F,
What letter is this?
H,
What letter is this?
D,
And what letter is this?
E.
Good. What color is this?
Red,
And what color is this?
green.
Good. So you can go go ahead and swap eyes and hands for me. Alright, you can go ahead and read this row, starting at the right and moving to the left.
S, B, J, H, D.
Okay, good. Go ahead and read this row for me, starting from the left and moving to the right.
C, F, D, H, J.
Good. Go ahead and read this row, starting at the left and moving to the right.
F, P, H.
Good. And what letter is this?
O.
What letter is this?
L,
What letter is this?
C.
What color is this?
Green.
What color is this?
Red.
Okay, good. I'm going to go ahead and set this aside. You can relax. I'm just going to go ahead and do a basic color test too, just to rule out any signs of developing color blindness. I have different colored eggs here. I'm just going to go ahead and hold one out, and you're going to tell me what color that egg is.
Blue. Yellow. Pink.
Good.
Green.
Good.
Orange.
Good.
Purple.
Before I move down to the lower body, we're just going to go ahead and do just a brief sensory test of the face. You've been passing everything with flying colors. Just want to go ahead and make sure everything is feeling good along the cheeks, forehead, chin, neck area. Go ahead and turn your chin up just a tiny bit. Perfect. And turn your head to the left just a tad bit. Great. I'm going to add, I have this nice soft little brush here. It's really light and gentle on the skin. I'm going to be swiping this over parts of the face and neck in brief little bursts. Go ahead and tell me how many times that this passes over the skin.
3.
Good.
2.
Good.
4. 1. 3, 2, 1. 3, 4, 1.
Great. You can stay comfortable. I'm just going to go ahead and move down to the stomach now. I'm just going to gently palpate the stomach. Everything is feeling nice and healthy. No signs of any blockages or draining beneath the skin. I am going to use my stethoscope here to listen to the noises of the stomach. It might be a little cold on the skin here. Everything is sounding nice and healthy. Normal noises of digestion. I do have my hammer tool here. I'm just going to gently percuss along the stomach. Let me know if this is ever uncomfortable. I'm going to go ahead and do a sensory test on your stomach. I have this water globe here, which has a nice cooling touch. And then I have the warmth here of my fingers. Go ahead and let me know when I press an object into your skin if the sensation you feel is warm or cold.
Warm. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. Cold. Warm. Warm.
Okay, good. Everything seems to be acting as it should. Sensory test went great. I'm going to go ahead and flip you over onto your stomach and we're going to take a look at your back. All right, Sydney, I'm going to move your hair gently out of the way. I'm going to begin by gently using palpations on your back. Feeling both the skin, the muscles, and bone structure beneath. I do have a skin-safe surgical pen here. I'm going to remove its casing. I'm going to be pressing down on some of your vertebrae. I want you to tell me if they hurt. Starting with one that I felt that feels slightly out of alignment. Right here. Does this cause you any discomfort? Okay. Feeling some swelling. I'm just going to mark where I feel the swelling begin and end. Mark it right here. Okay. Continues on. And this is where I feel the most swelling. I'm going to just measure. It's about 1.5 inches, a little bit over. Okay. I also felt some swelling around the shoulder blades, mainly in the right shoulder blade. I felt some tension over here. Does this cause you any pain?
No.
Gently feel around. Seems to be the worst. Right around here. Just gonna mark a delicate X. And I did feel a lot of tenderness and inflammation around this area. This is pretty much where you described as the pain being the worst, so I'm not going to press too hard, but I am going to mark a delicate X. And just go ahead and mark these areas of the skin as areas in need of the most attention. I'm going to gently begin some acupuncture therapy. This is going to help me assess the muscle density and swelling of the area, as well as hopefully offer a little bit of relief. Let me know if this is ever uncomfortable. Around along the spinal column, gently applying this pressure. I'm going to use this rolling acupuncture tool over the areas that I marked off as being the most tender and inflamed. Helping to increase blood flow and massage the knot that is forming here. using my little measuring stick here to measure the distances of the swelling from one another. So it looks about to be 7 inches apart. This one to be about 6. Now I'm going to go ahead and remove the markings here. I have an alcohol pad I'm going to use to rub against the marker and to remove it from the skin. Using circular motions to wipe the marker off the skin. Now I do have some spot muscle relief. I'm going to gently apply that onto my gloves and spread it onto the areas of attention. Might be a little bit cold. hopefully this is able to give you some relief. I'm going to go ahead and flip you over and take a look at your feet, and then we're going to go ahead and wrap up the exam. Go ahead and relax, Sydney. I'm just going to be putting on a fresh set of gloves. I'm going to start by gently palpating the feet, moving any fuzzies from the sides. The feet are a bit cold, which is normal and natural. All the bones feel straight and structured. No signs of any swelling, no fractures or sprainage around the foot or the ankle. I'm going to go ahead and take 2 samples here, just from between the toes. And on the other foot as well. So gently and delicately between the toes. And this guy into a vial and then sealing it up. I'm not overly concerned about the feet. They seem nice and healthy. I do want to do a brief sensory test, just to make sure that we have the sensation among the top of the foot mostly. You can go ahead and relax. I'm just going to go ahead and grab tools for a sharp or dull test. Go ahead and let me know if the sensation that you feel is sharp or dull. Sharp. Good. Dull. Good. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Okay, good. All right. I'm gonna go ahead and pack up my stuff here, and then we can talk about the results of the exam. All right, Sydney, now that we've completed the exam, I did want to go ahead and go over your results. So every sensory test that we did, you passed with flying colors. Everywhere except the back seemed totally fine, except those areas that I marked along the vertebrae did seem really tender and swollen. Hopefully some of the procedures that we did today helped to alleviate a little bit of that pain, but I'm going to go ahead and make a note here asking that you come back in 2 days to get an MRI as well as some other some tests done so that we can really determine the root of the pain and if anything was sprained, broken, or strained. Thank you for coming in today, and I will see you again soon.
Thank you.